Hey guys, welcome back for part 3 for chapter 7. This is going to be covering the appendicular skeleton. Okay, so the appendicular skeleton is talking about your limbs and their girdles, so how they're attached to the body. So remember previously we did your skull and we did your spine and then we did your thoracic cage, which is really your rib cage. Now we're going to be doing your limbs. Okay, so that's what we're focusing on today. The appendicular skeleton focuses on limbs and how they're attached to the body. That's called a girdle. So we're going to be covering the pectoral girdle, which is how your upper limbs are attached to the body, and the pelvic girdle, which is how the lower limbs are attached to the body. Okay, so first in our pectoral girdle, we have our shoulder girdle. That's how your arms are attached to your body. It's going to be your clavicles anteriorly, which is going to be your collarbones, and your scapula, or your shoulder blades that are going to be on the back of your body posteriorly. So we have the attachment of our upper limbs to our axial skeleton through the pectoral girdle. Okay, and this is going to provide the attachment site for muscles that are going to help us move our upper limbs, and it's going to offer a great deal of mobility because the scapula, your shoulder blades, are not attached to the skeleton, which is really great for us to be able to, move our arms around and everything, little bat wings back there, your scapula. And then your the socket of the shoulder joint is shallow and it doesn't restrict the movement of your arms, so your arms can make full circles. So this is a picture of what we just talked about here. This is it's focusing here on your pectoral girdle with the articulating bones. So we're going to talk about these different parts in just a second. Okay, so we're going to talk about the clavicles. So the clavicles are your collarbones. The S-shaped sternal end is going to articulate with the sternum. The sternal end meets up with the sternum. Okay, and then the flattened acromial end is going to articulate laterally with your scapula or your shoulder blades. So these are going to help to anchor muscles and attach as these little braces to hold your scapula and your arms out laterally, and it allows for a lot of mobility. Okay, so this is what the clavicle actually looks like. So it's kind of like an S shape that's been stretched out. Okay, so you have your acromial end here. It kind of looks like a fan. And then on this side, this is a more blunt end, and that's going to meet up with your sternum. This is just the other side of that. So your sternal end, again, is very straight up and down, whereas your acromial end is kind of more of like a fan shape. Okay, our scapula. These are going to be our shoulder blades. They're very, very thin bones that are triangular in shape, and they're flat, and they're on the dorsal surface of your rib cage, so behind your rib cage, between ribs 2 and 7 specifically. Each of these scapula has 3 different borders, the superior, medial, and lateral borders. So the superior is going to be the shortest and sharpest border. The medial, so in the middle, is going to run parallel to the spine. And then the lateral border is going to be near your armpit, which is going to end superiorly in the glenoid cavity or fossa, which is your shoulder joint. Okay, each scapula has 3 different angles where the borders are going to meet: a superior angle, lateral angle, and an inferior angle. And we'll look at all those in a second. And then our bone features we're going to talk about for each of the scapula, your shoulder blades. They have a spine, which is going to be something very prominent. It kind of looks like the spine, like of your body. It's a big ridge on the back of them. You have the acromion, which is going to be the lateral projection that articulates with the acromial end of the clavicle to form the acromioclavicular joint. So that's where the clavicle attaches. And then you have your coracoid process, which looks like a little finger sticking off. It's going to be an anterior projection that anchors the bicep muscle of the arm. You have your suprascapular notch, which is going to be an opening for nerves. And then you have a lot of different large fossa, which, remember, just holes that are named according to their locations that we're not really going to focus on. So you're going to see more things in this picture than you actually need to know. Okay, so we talked about the coracoid process, glenoid cavity, acromion. Those are like the big things here that you need to know. Okay, so this is one view of the shoulder blade. We're going to look at a couple different ones, but again, this is the region of the body that we're focusing on here, the dorsal side behind our thoracic cage, the scapula. This is one of your shoulder blades. So you can see the little acromion here is sticking off. This is your coracoid process. Okay, the glenoid cavity is actually going to be where your arm is connecting here. And then you, of course, have the acromion in the back. And then you'll see the ridge in just a minute. This is what I was talking about here, this big ridge called the spine. It kind of meets up with the acromion at this end here. Okay, so those are the big things that you needed to know about. So the spine is this big ridge. It kind of looks like a spine. The glenoid cavity here is going to be where your arm's actually going to help. It's going to help your arm attach. It's a cavity for your arm bones. And then you have the coracoid process and the acromion here. Okay, this is another view. This is a lateral aspect, and it kind of looks like this weird Y-shaped structure. Okay, so you can see the glenoid cavity, again, where your arm is going to attach. You can see that spine coming off the back. You can see the acromion. You can see the coracoid process. Those are the things that we were kind of focusing on in the last few pictures. So this is like if you were looking at somebody's side view. Okay, we're going to talk about the upper limbs next because that's what's going to be attaching to that glenoid region, that glenoid cavity. So there's 30 different bones that form the skeletal framework for each of the upper limbs. So you have the arm, which starts off from the shoulder moving downwards. We're going to talk about the humerus. Okay, the humerus is that big long bone in your arm that comes between your shoulder and your elbow. Your forearm is composed of your radius and your ulna. And then your hands have carpals, metacarpals, and phalanges. Now, I'm going to tell you that in this presentation, it talks about all of the bones of the carpals and the metacarpals. I don't really care what each one is called specifically or exactly how many we have. I just need you to know what they make. Okay, so we'll talk about that when we get to all the pictures. So that's just like a forewarning. Again, you're going to see a lot more vocabulary than you're actually responsible for, so don't get bogged down in the details. So we have the arm, the forearm, and the hand, humerus, radius, ulna. We have our carpals, metacarpals, and phalanges. Again, that's from your shoulder down to your fingertips. Okay, so the humerus starts off the upper part of your arm. It's the only bone of the arm. It's the largest and longest bone of your upper limb. It articulates superiorly, so at the top with the glenoid cavity of the scapula, which is where we just said that's how your arm is attached to your shoulder. Okay, and then you have your radius and ulna that are going to be articulated with inferiorly. So these two bones come to make up your forearm underneath the humerus. Okay, so then our bone features we're going to talk about. We have the head, which is the proximal end that's going to fit into the glenoid cavity of the scapula up at your shoulder. You have the anatomical neck, which is a slight constriction inferior to the head, so it kind of like curves in a little bit after the head. You have a greater tubercle, which is going to be separated from the lesser tubercle by the intratubercle sulcus. You don't need to know all of that, okay? We're just focusing on like where it's attached and what it's attached to. Then you have sites of attachment for the rotator cuff muscles, which you hear about a lot of athletes tearing. And then you have something called the surgical neck, which is the most frequently fractured part of the humerus. Okay, more features of this. You also have a deltoid tuberosity, which is midway down, which is where the deltoid muscle is going to attach. You have a radial groove, which is going to carry the radial nerves. You have the trochlea, which is a distal hourglass shape, so it kind of like goes in on both sides. Hourglass shaped condyle. You have the capitulum, which is the distal ball-like condyle. It's going to articulate with some of our lower bones. You have the medial and lateral epicondyles that are going to be points of muscle attachment. You have medial and lateral supracondyle ridges, and then fossa, again, our little like holes and pores, our coronoid, olecranon, and then the radial. So let's look at this. Okay, so you have the head that we were talking about, and we also talked about the greater tubercle and the lesser tubercle, the intratubercle sulcus. That's all fine. Okay, but the head is going to be where it's attaching up in your shoulder area. Okay, and then down at the bottom, you have these like the radial fossa where you're going to have radial nerves going through. You have the capitulum, which is going to interact with some of our lower bones. You have the trochlea, which is also going to interact with some of our lower bones. If you look at this, it kind of looks like a balled up fist to me with like your middle finger kind of like sticking out a little bit, right? That's kind of what it looks like to me. That's an easy way for you to identify this bone versus some of the other long bones in the body, because you will have to do that for the practical. It kind of looks like a fist with like a weird little middle finger kind of jutting out a little bit. So that's what our humerus looks like. This is the humerus of the right arm, and there are detailed views of articulation at the elbow. Okay, so we talked about the olecranon there. So this bone that actually is going to be helping to form our elbow. Okay, we talked about the head, the neck, our radius on our ulna are going to be below everything. And then, of course, our humerus extends up this way. Okay, so the forearm, so moving down, so now we're going to be talking about the region of your arm between the elbow and your wrist. So before we were talking about the humerus. The humerus is between your shoulder and your elbow. It's going to be the proximal region of your arm. We're going distally here, so we're going to move down distally. We're going to be moving from the elbow to your wrist. So there are two parallel bones that form the forearm of your skeleton called the ulna and the radius. The proximal ends are going to articulate with that humerus that we just talked about and each other. They're going to also distally articulate with each other and the radio-ulnar joint, okay, as we get into our towards our hands. Okay. You also have interosseous membrane that's going to connect the radius and the ulna along the entire length. So it's this membrane that exists between these two bones because they're close together, but they're not exactly touching. Okay, so first we'll talk about the ulna. So the ulna is the medial bone. Okay, so remember that the anatomical position, the thumbs face out. So the ulna is on the same side of your arm as your pinky. So if you're looking at your arm, wherever your pinky is, between your pinky and your elbow on that outside part, depending on which way your arm is facing, I guess I'm looking at my hand right now, just flat on the table, right? So between your pinky and your elbow is going to be your ulna. Of course, the radius will be on the other side between your thumb and your elbow. Okay, so the ulna forms the portion of your elbow. It forms a major portion of the elbow with your humerus. Again, that's the upper bone. The bone features, you have the olecranon and the coronoid process that are going to grip the trochlea of the humerus, forming a hinge joint that allows you to bend your arm. Then we also have different processes that are going to separate that are separated by the trochlear notch. You have the radial notch, the ulnar head, and the ulnar styloid process. Don't get bogged down in the details here. We're just looking at the different bones and how they're connected, okay? Our radius, like I said, is going to be the other side of your forearm. So this is between your thumb and your elbow. Remember, the ulna is your pinky and your elbow. Okay, so the radius, I like to think about it like the radius rotates because your thumb has a lot more movement. Okay, so it's going to be the lateral bone. So again, if your thumbs are pointing out away from your body in anatomical position, it's going to be the lateral bone, the bone that is furthest away from the body. The bone features we're going to talk about are the head, the radial tuberosity, the ulnar notch, and the radial styloid process. So the head is going to articulate with the capitulum, which we looked at in the humerus, and the radial notch of the ulna that we just talked about as well. We have the radial tuberosity that's going to anchor the bicep muscle. You also have the ulnar notch, which is going to articulate with the ulna, and you have the radial styloid process that anchors ligaments. So here's some pictures of what we just talked about. So this is going to be the radius and the ulna of the right arm, forearm. Okay, so we have our radius here and we have our ulna here. So if your hand was coming off the end of these, you'd have like your wrist, this would be your pinky, and then you'd have all your fingers, ring finger, middle finger. This person has fat fingers, pointer finger, and then you'd have your thumb. Okay, I'm really great at drawing. So your thumb side, if this is your little thumbnail, get it? Thumbnail, okay. That's going to be on the radius side. And if this is your little pinky, okay, that's going to be on the ulna side. So with your radius, you have the head, you have the neck, the radial tuberosity. You also have the radial styloid process that's going to interact with the wrist. You have the olecranon bone, section of the bone in the ulna that's going to help to form your forearm. And if you look at it from a side view, this actually makes like a C shape, and a C that's on its side looks like a U, ulna. Oh my gosh, that's convenient. Okay. And then remember that we also talked about the interosseous membrane, which is just going to kind of like give extra support and structure to the bones here. Okay, this is the radius and ulna of the right arm continued. So like I said, this kind of makes like a little C shape here. This is the trochlear notch. Okay, the olecranon is going to be up at the top part of this. This is kind of helping to form your elbow. So again, this little trochlear notch, this little C shape, a C turned on its side is a U, ulna. Okay, that might help you kind of remember some of that. Okay, we're going to talk about the hands next. So the bones of the hands include the carpals, metacarpals, and phalanges. They can also be called like the carpus, which you see here. So carpals, carpus, same thing. It's talking about your wrist. There are 8 different bones. That's all I want you to know. Okay, so you have carpals, metacarpals, and phalanges. Your carpals make up your wrist. Okay. Yes, there's 8 different bones. It tells you the name of all of them. I don't really care about the names of them. I just want you to know carpals make up your wrist. Okay. Um, your metacarpals or metacarpus is kind of the palm or like the back of your hand and like the palm of your hand before you get to your fingers. There are 5 different metacarpals. Again, I don't really care what they're called. I just want you to know that you have 5 fingers and you have 5 metacarpals that will lead to your fingers. Okay, and then lastly, you have your phalanges. These are the fun ones. They're your little fingers, okay? So you have 1 through 5 starting at the thumb, the pollex. Okay, and we'll look at a picture here to show you what's going on. Here's your hands. Okay, you have your carpals. Yes, it labels them all. No, I don't care. There are 8 bones that make up your wrist. And then this region here is going to be your metacarpals. And then these little guys make up your phalanges or your fingers. Okay, so you have your wrist, carpals, the middle section, metacarpals make up the middle of your hand, your palm of your hand. And then you have your phalanges. You have the proximal phalange, the middle, and the distal. Proximal, middle, distal, proximal, middle, distal, proximal, middle, distal, proximal, distal. What do you notice here with the thumb? It's special because it does not have a middle phalange here. So that's something special about the thumb that you need to know. Okay, cool. So the same thing on your other hand, but those are the bones of your hands. Okay, so the next thing that we're going to talk about is your pelvic girdle. We talked about the pectoral girdle, how your shoulders are kind of created, how your arms are attached, all the different bones that make up your arms and your hands. Now we're going to talk about your pelvic girdle and the lower limbs. So the pelvic girdle is also called the hip girdle. It's formed by 2 hip bones, and those are also called coxal bones, and of course our sacrum, which was at the bottom of our spine, followed by the coccyx, that's your tailbone at the very, very bottom. Okay, so it's going to attach the lower limbs to the axial skeleton. Remember that our axial skeleton is our little skull, our spine, and then our thoracic cage, our rib cage. That is your axial. We're talking about the arms and the legs now, which makes up your appendicular skeleton. Okay, so it's going to attach the lower limbs to the axial skeleton with very strong ligaments. Okay, it's going to help to transmit the weight of the upper body, and the lower limbs are going to help to support our pelvic organs as well. We have less mobility here, but more stability than our shoulder joints because these are bigger limbs and they're stronger limbs and they're more weight-bearing limbs. Your arms aren't really bearing a lot of weight unless you're like lifting things. I like to pick things up and put things down, right? Your legs are constantly holding up your weight. Okay, so you have 3 fused bones that are going to form the coxal bones. You have the ilium, you have the ischium, and you have the pubis. You have the deep socket, acetabulum, we're going to talk about, and then formed at the point of the fusion receives the head of the femur. So we're going to talk about the socket and the acetabulum here in just a second. Okay, so here's the overall structure. So you can see that this is actually not part of your pelvic bone or your pelvic region, your pelvis. This, remember, the sacrum is just a continuation of your vertebra, and then your coccyx is your tailbone down at the bottom. Okay, but here we have the ilium, which kind of turns into the pubis here as it enters the front area. So we have, again, our ilium that turns into the pubis towards the front. And then you have the ischium, which kind of makes up like the bottom posterior region. It's kind of sitting towards the back of your body. So this is your overall hip bone. Again, the ilium, pubis, and ischium are the 3 main parts that make up these coxal bones. Okay, so the ilium is going to be the superior, so the top region of the coxal bone. It's going to have an auricular surface that articulates with the sacrum. Remember, we talked about the sacrum at the bottom of your spine, followed by the coccyx. You have the ischium, which is going to be the posterior, so back, posterior, inferior, below part of the hip, so the back lower part. And then you have the pubis, which is going to be the anterior, the front portion of the hip bone. And then, of course, the pubis is going to be joined at the middle pubic symphysis joint, and that's got a little tiny piece of like cartilage between it here to keep the bones from like rubbing on each other. Okay. So we'll talk about the ilium first. So we have the superior region of the hip bone. We have the iliac crest that are going to be the thickened superior margin of the ala. Those are kind of like the wings, kind of. Okay, you have the iliac crest that ends at the anterior superior. So the anterior is the front, superior is upper, iliac spine, and posterior superior iliac spine. Okay, so we'll look at some pictures in a second. You also have the greater sciatic notch, which is going to allow passage of the sciatic nerve. And you might hear about the sciatic nerve getting pinched with pregnant women a lot, because think about where a baby is. It's going to be sitting somewhere between these pelvic bones, right, within your coxal bones. You have the gluteal surface that contains 3 different ridges: posterior, anterior, and inferior gluteal lines. You also have the iliac fossa, which are just going to be, again, like holes, passageways for nerves and blood vessels. You have the auricular surface that's going to articulate with the sacrum, which we just talked about, and then the arcuate line that's going to define the pelvic brim. Okay, the ischium. Okay, this is going to be like the lower part. The ischium is the posterior, so the back, inferior, below part of the hip bone. It consists of a body and a ramus. It has 3 important markings: the ischial spine, the lesser sciatic notch, and the ischial tuberosity. My groceries are ready. Wonderful. Okay, then the pubis. Remember, the pubis is kind of like the wrapped around part that forms like the front, like your pubic bone, the front part. It's a V-shaped anterior portion of the hip bone. It consists of the body and superior and inferior pubic rami. The anterior border forms the pubic crest. You have the lateral ends that are going to be that form the pubic tubercle. You have the obturator foramen. Remember, a foramen is like an opening. It's a large opening formed by the rami and the body. And the pubic bones are going to be joined at the pubic symphysis. Then you have the pubic arch, which is going to be a subpubic angle. So it's like underneath. And you'll see like a wide angle in females and like a deeper or a more acute angle in males. And we'll look at that in just a second. There's a huge difference between the male and female pelvises. I don't know. And that's the big difference there, the subpubic arch or angle. Okay, so we'll look at the arch and the angle in just a second here. This is a lateral view for you, okay, to kind of point out some of the things that we just talked about. As I said in my last video, go ahead and I did not color code it for you, but just everything we just talked about, make sure that you go back and identify everything here. You can pause. And then this is the medial view, so from the other side. Okay, so we're going to talk about the pelvis and childbearing, like we were just talking about that angle and how it differentiates between male and female pelvic regions. So the pelvis is formed by hip bones, the sacrum, and the coccyx. That forms the total pelvis. The female pelvis tends to be wider and shallower. It's lighter and rounder than males. Okay, why would all these characteristics be specific for females? Because they're going to have kids. Well, not necessarily. That's your choice. It's 2020. You can do whatever you want with your life. Okay, but if you are a female born with XX chromosomes, then that means that your bone structure will be different than that of a male that was born with XY chromosomes. Okay, and this is for childbearing. That's why literally your bone structure is different. You also have mammary glands on the front of your chest that are there to feed offspring. Okay. So we're going to talk about the pelvic brim, which is a pelvic inlet too. It's a continuous oval ridge that runs from the pubic crest through the arcuate line and the sacral, this word gets me every time, promontory. This is like tongue twisters for me. Then you have something called the false pelvis and the true pelvis. So the false pelvis is going to be superior to the pelvic brim. And you have the true pelvis, which is going to be inferior to the pelvic brim. And this actually defines the birth canal. Okay, and then you have the pelvic outlet, which is the inferior margin of the true pelvis. So let's look at this. So you can see here, it tells you that this is female and this is male. Okay, so if you just look at the overall shape, I kind of said this looks like a heart. So this is like a wide, fat heart. And this is like a taller, skinnier heart, right? That's because this opening has to allow for a child to pass through it, right? So this smaller opening here would not be very great for pushing a child through. So we'll talk about that pubic arch or the subpubic angle here. So in females, it's broader and it's more round. So you can see this arch right here is what we're talking about. So it's a much wider angle versus this narrower, shallower angle here because the hips literally sit further apart in order to allow passage of a child. This is a side view of what the hips look like. So in a male and a female. So you can see that the sacrum here and the coccyx actually curve like in, and you could not pass a child through that like 1 millimeter looking opening right there, right? Whereas in the female, you can see that you have a less curved sacrum and coccyx, which is going to allow for this like wider opening. I'm using black, so it's kind of hard to, can I do this? Cool. Okay, so this opening here is much larger than whatever exists right here in order for a child to pass through. Look at me being technological. Okay. Here's another view which even shows more about that sacral and coccyx curvature that you can see here. It's a much deeper curve than it is here. And what does that do to this opening? Well, it literally like narrows it down so much that you can't pass, you know, you only have this space to try to pass a child through, where here you have a lot more space in this direction, but also a lot more space in this direction, right? Comparatively. So this is why women have a different bone structure in order to pass a child out of their bodies. Okay, next we're going to talk about lower limbs and then we're out of here, okay? So the lower limbs are going to carry the weight of the standing body, the erect body. So it's subjected to exceptional forces during jumping, running. There's a lot of stress, pressure, tension that's put on your lower limbs. And your lower limbs are made of 3 different segments: your thigh, your leg, and your foot. Okay, so the thigh bone is called the femur. It's the largest and strongest bone in the body, and it makes up about 1/4 of a person's height. So it's a pretty big percentage there. It articulates proximally with the acetabulum of the hip and distally with the tibia and patella. The patella is a sesamoid bone in the quadricep tendon that actually protects the knee joint. We'll talk about it in a minute. It's this little bone that sits in front of all of that. Okay, bone features we're going to talk about. Distally, the femur ends are lateral and medial condyles that articulate with the tibia. So that's going to be one of your leg bones. The medial and lateral epicondyles are going to be sites for muscle attachment. You have a lot of muscles here. Again, this bone is the biggest, strongest bone. Okay, you're going to have a lot of muscles to also help support your body. You have the adductor tubercle, which is going to be the medial epicondyle bump. You have the patellar surface that's going to articulate with the patella. And you have the intercondylar fossa. These are little holes that are going to lie between the condyles. Okay, this is going to be your patella here, your kneecap. Okay, so this shows you where we're talking about on your body. So it's between your hip, like where your leg meets your body, and your kneecap. So this is going to be the proximal region of that. You can see that you have the head of your femur, which fits into your hip bone. You have the neck that kind of caves in a little bit here. And then you have the long region going all the way down to the lateral epicondyle. You have the patellar surface here that's going to interact with the patella, which is over here. That's your kneecap. And then this is the posterior view from the back. And you can see some of the other fossa and condyles that it's talking about on the back of your femur. Okay, so I'm going to let you pause and look at these because we're going to basically talk about all these different things. So if you want to read the chart, you can stop, look at the chart. Okay, so the leg sits below your thigh. So we're looking from kneecap down to your ankle. Okay, it's made up of 2 different parallel bones, kind of similar to your arm. Okay, they're called the tibia and the fibula. Okay, they're connected by that same interosseous membrane that existed between the radius and the ulna of your forearm. Okay, the tibia is going to be the medial leg bone, so towards the middle, that receives the weight from the body from the femur. Okay, and then it's going to transmit it down to your foot. So you have this larger bone taking a lot of the stress away, and then we're tapering down to your tibia. The fibula is the thinner of the two, and it is a non-weight-bearing bone. It does not articulate with the femur directly. It has several muscles that originate from the fibula. And then it's going to articulate proximally and distally with the tibia. So we'll look at some images in just a second. The bone features we're going to be talking about in the tibia, we'll talk about that one first. Okay, we have the medial and lateral condyles. You have the intercondylar eminence. You have the tibial tuberosity, anterior border, the medial malleolus. You have the fibular notch, and then you have the fibular, for in our fibula, you're going to have the head and the lateral malleolus. So let's take a look at those. Okay, here's that interosseous membrane that we talked about. Same thing that's in the forearm. It's just to add support and structure to keep those bones from like rocking around as you're jostling your body or jumping and everything like that. They're just adding extra support. So this is going to be the section that kind of meets up with the patella to help to make your kneecap. Okay, so this is going to be like your kneecap would sit here, and then your femur is going to articulate on this surface here with the medial condyles and all of that. You can actually feel the tibial tuberosity, these little like bumps that are below the patella. So if you touch your kneecap and then like go down your leg a little bit, you can feel those little bumps there. So remember that the tibia is sitting directly underneath the femur, and it's going to be the weight-bearing bone. And then you have your fibula, which is a non-weight-bearing bone. That's going to be the smaller and skinnier one that's off to the side. Okay, this is the tibia and fibula of the right leg. So you have the anterior view and the posterior view. You can see the lateral condyle and the tibial tuberosity. Like I said, those are like little bumps that exist below the patella. And then on the back, you can see some other bone markings that we're not really going to focus on too much. Okay, the foot is similar to the hands. So once you know what's in the hands, which we already talked about, it's very similar in the feet. So the skeleton of the foot includes the bones of the tarsus or tarsals, the metatarsus, metatarsals, and the phalanges. So just like carpals, metacarpals, phalanges in your hands, you have tarsals, metatarsals, and phalanges in your feet. Very similar. You have the tarsus or the tarsals. There are 7 of them. No, I don't need you to know the names. Okay, they are body weight. The body weight is carried primarily by the talus and the calcaneus, the calcaneus or the heel. So we have the talus and the calcaneus that we're going to talk about in a second. That's going to be the weight-bearing portion. And the calcaneus, calcaneal tuberosity is the part that touches the ground. So like when your foot like actually like meets the ground, like that's the part that meets the ground. If these are your toes and this is your ankle going up to your leg. I'm so great at drawing. Okay, so the metatarsals are going to be, again, 5 bones because you have 5 toes. Okay, I don't need you to know the names of them. I just need you to know there are 5 because you have 5 toes on each foot. So you have a total of 10 of these bones. Okay, you have the phalanges again, which are going to be very similar to the structure of our hands. You'll see that there's only 2 bones in one of them and 3 bones in the others, which we'll talk about, similar to your hands. Okay, so here you have the talus, you have the calcaneus. Okay, you have the tarsals that's showing you this region here. And then you have your 1, 2, 3, 4, 5 metatarsals. So these are your metatarsals here. Okay, and then you can see phalanges again. You have proximal, middle, distal, proximal, middle, distal, proximal, middle, distal, proximal, middle, distal, proximal, distal. There is no middle phalange on your big toe, similar to your thumb. So it's exactly the same. This is a side view here, so you can see the calcaneus here that we were talking about. Calcaneal tuberosity is the part that actually touches down on the floor. So this starts to kind of create some of your arch, and not everyone has an arch that touches the floor unless you're like flat-footed, which does not make you any less special of a little human. Okay, this is just the lateral view of the foot. You don't need to know all of these other, we're looking at the talus and calcaneus. Those are all good. I'm not going to focus on these other terms. Okay, now the arches. So that's like the part of your foot that I pointed out here and here. Okay, it's the part of your foot that doesn't touch the ground necessarily. So it's maintained by interlocking foot bones, ligaments, and tendons. It allows your foot to bear weight. and you have three different arches that are just running in different directions. You have the lateral longitudinal, you have the medial longitudinal, and the transverse. So the lateral longitudinal is a low curve that elevates the lateral part of the foot. The medial is going to, the arch is going to curve upwards, and then you have the transverse that's going to run obliquely from one side of the foot to the other. So here's the direction that our arches are actually running. Okay, so you have your medial, transverse, and your lateral arches. So this is what's allowing your foot to bear weight. It's kind of like a distribution of weight between like the ball of your foot and your heel. Okay, we made it. We're done with the bones. I'll see you in the next one. We start talking about some muscles. Have a great day.